having that ability to being on the front lines, seeing patients, dealing with the EMR, seeing how these workflows affect in real time are really valuable. And I think it's valuable to our organization as well.
This is Zach with the American Journal of Healthcare Strategy, and you are listening to the Clinicians in Leadership Podcast series, where we focus on empowering clinicians from bedside to boardroom. Today, I am joined by Dr. Julia Flax. Dr. Julia Flax, do you mind introducing yourself?
Absolutely. And thank you so much, Zach, for having me. This is a great opportunity. And I enjoy talking about leadership and different topics like that. So thank you so much. I'm a family physician, went through medical school, residency, and then work for Cox Health in Springfield, Missouri. I've worked there since residency, so over 20 years. I'm an employed ambulatory physician, so I do outpatient work. Also, I do a lot of administrative things that started usually, I think it was about 6 to 7 years after starting Cox Health. I still did full-time family practice for a while, but I also became Cox Health medical director. And that served as my introduction to the insurance, the payer programs, RVUs, contracting. So it was a lot to learn credentialing, but it was a good experience. I learned a lot in that role. About that time, too, we had the ACA be approved, and MACRA and MIPS were heading this way, the explosion of Medicare Advantage plans, advanced payment models. So over the next few years, we started working with those advanced payment models, including Medicare Advantage, shared savings programs. We were involved with the next generation ACO for 3 years, right before the pandemic hit. And so that evolved my work into the Chief Population Health Officer at Cox. We have a robust population health department. It's just a blessing to have for our family physicians in particular. It really takes a lot of burden off of them to try to take care of our patients, but also the patients love it. We see a lot of improved health outcomes and decreased costs from it. So that's my current role as a Chief Population Health Officer.
Well, and I have heard about your health system's population health, that the way that you guys approach that is unique and really, really cool. And I think that one of the most impressive things that has stood out to me just looking throughout your experience, which you have a wealth of, both clinical and administrative, is the fact that you identified this. You've been in the same health system for the majority of your career, if not the entirety of your career. And so I'm curious, throughout your career in that same health system, what have been some of, or one of the most impactful experiences that have developed your approach to leadership?
Sure. Like you said, I've been here a while and have been blessed to participate in different leadership roles. And from each one, I've actually gained a lot of insights, a lot of different skills. I've learned from many of our administrative leaders, a lot of different techniques I've learned from them. Some things that weren't natural to me, I've tried to incorporate, like more storytelling, giving that narrative. I think that's a good trait. So I've really learned a lot from different roles. I think the most impactful of late has been my work in physician well-being. We are starting up a formalized physician well-being program here at Cox Health. We've been doing things for physician well-being for some time, but it's just never been formalized and promoted it like it could be. And, with the quadruple aim at the time, really promoting physician well-being, recognizing the distress that physicians were in, we've really understood the importance of that to take care of our physicians and clinicians altogether. So that work has been a really growing experience because we don't have a playbook for that. We're pioneering this on our own within our health system. So that's been something different. Usually when I've gone into a leadership role, there's a mentor that I'm fulfilling or succeeding, I guess is the term. And, I'm getting a little mentorship there, guidance. There's a way to do these things. Of course we can always tweak, but there's that foundation there. So this is brand new. So it's increased my ability to really be agile, flexible, collaborative with other departments, especially with leadership, our physicians, our key physician leaders, how to gain buy-in and really do some appreciative listening and see what really is impacting them in their workflow, what is really those pebbles in the shoe that we could work on to improve their well-being.
Mm.
Also working with human resources, IT, of course, because the EMR is just such a headache for us. How can we optimize that? Marketing, communications. How do we get the word out about what we're doing? Make sure we're engaging the physicians and doing what they need. And then surveying the physicians, actually seeing where are we standing in physician well-being, where is our distress level right now, and then measuring that against national benchmarks, also looking for different areas in our system, different service lines that may be struggling more than others, and then doing a deep dive with them and having meetings with the medical director, the administrative director, to see what are your pain points and if we can help them with some process improvement projects to improve that. And then hopefully in the future, we want to come back, measure that, and make sure that all those things we're doing are making a difference. We're improving physician well-being. But if we're not, we want to not do things that aren't helping. So that whole thing has just been challenging, but it's been very rewarding as well.
Oh yeah. And again, I'm thrilled to have you on today, just to hear just ways that you serving in the different roles that you have served has just improved the Cox Health system, and just the patients have benefited as a result. So I'm also curious, what inspired you to pursue a leadership role as the chief population health officer within the Cox Health system?
Yes, I've been blessed to work at Cox. I love the organization. It's physician led, so I have stayed here a while, but that has given me some insights into the local community and our patient populations. One of the reasons I did want to pursue more of an administrative role with the chief population health officer opportunity is to expand my scope of reach and how I can impact people. Being a physician, it's a blessing. One of the most of the time when you ask a person, "Why did you want to be a physician?" the common answer is, "I want to help people," and so that's my kind of boring answer, but it's true. And by being a physician in the clinic, I get to help people every day, one on one in that clinic setting. When given the opportunity for some of these administrative roles like chief population health officer or medical director, not only can you help people one on one, but you can really apply that on a grander scale. For example, some of the outreach opportunities for screenings, like our colorectal cancer screening that we do every year. We've done that since the pandemic because people couldn't come in for their colonoscopies. So we started doing that and had success. So things like that, how can we really help people on a grander scale? That's been the attractiveness to me, and that's given me a lot of fulfillment.
Well, and I mean, I think that we've mentioned a number of times here, but I think that your career with Cox Health and just the length of that career within the same healthcare system is something that is not super common in today's culture. And since graduating medical school, you started out a physician, had other various roles, both clinical and leadership, and then now you're the chief population health officer for the system. So I'm curious, how has your clinical experience within that same healthcare system and with the same patient population that healthcare system serves, how has that influenced your approach to administration, I guess, throughout your career, but more specifically within your present role?
Oh, that's a great question. I think that's important for a lot of clinicians who are seeking leadership roles. I was not trained in business management, really any leadership training throughout my medical school and residency, so that might not come naturally. But it's important that we develop those as clinicians and actually be there at the table with those administrative leaders. So we have a dyad structure here. We have the clinician leader and the administrative leader. And I think that's invaluable from the clinician's point of view because you have that insight into how this affects the patients at the patient level, the complexities of the healthcare delivery system in itself. I mean, you're on the ground running with these patients, and you know how maybe sometimes different things, initiatives might have some downstream consequences that might be negatively affecting patient care, which might not be seen if someone who is not a clinician is making these decisions. So I think it's really important that clinicians rise up to these leadership roles when able. Um, Also, just being in that clinician role, every day I'm working in the EMR. I feel the pain, so to speak, of some of my colleague physicians. So
Yeah.
it's easier for me to understand what decisions at the higher level might trickle down, and we don't want it to cause any more burdensome work for these physicians. So I think having that ability to being on the front lines, seeing patients, dealing with the EMR, seeing how these workflows affect in real time are really valuable, and I think it's valuable to our organization as well.
So something else I'm curious about, and I think you have a unique perspective on this next question because I mean, like we've said several times before, you've been a physician, now you are a physician leader, specifically the chief population health officer, and you've done that within the same healthcare system, within the same patient population. So I'm curious, how does your organization, how does Cox Health, the system, engage with the local community to better understand their healthcare needs? And then kind of second part of the question is how does Cox Health align their strategic goals with the needs of that same community that you serve?
Yeah, that's a great question. We're a community-based hospital, so that is near and dear to our heart. Actually, our mission
Mhm.
statement is to improve the health of the communities we serve. So it aligns with our strategic goals just naturally. And being a family physician, that just speaks volumes to my heart, because that's why we went into healthcare is to improve the health of people. I think one of the things that is helpful for us is every 3 years we do a community health needs assessment, and by doing that, we're able to identify different demographics in our area, different social drivers of health that might be an issue, top poor health outcomes. For example, we might have a higher rate of diabetes or mental health issues or drug use, tobacco use, those type of things. Social drivers of health. We have a higher food insecurity in certain areas, poverty in certain areas, transportation issues. So by being involved with that community health needs assessment, kind of keeps our perspective of how best can we impact our community. Another thing we do through our population health team in particular is use that information and then use our data analytics to identify patients in our populations who are maybe having some of those social drivers of health who might benefit from some community services. So one of the things we do is we also act as a bridge to community-based organizations, public health, to really help impact those social drivers of health. I think most of us are aware of the studies that show that only 20% of health outcomes are determined by what's happening in that clinical visit or that clinical setting. So much is outside of that. And as a hospital organization, it's hard for us to really impact that with, our operating margins not, it's good, but we don't have the resources to really do those things that we need that public health setting, that community-based organization, even working collaboratively with insurance payers who are providing these resources as well. So it really needs to be this team-based approach to providing care. So I think having that insight into our community, like for example, we received a grant from the American Academy of Family Physicians recently for our population health team, and we identified patients in our Medicaid population who have poverty and also food insecurity, who have diabetes and or hypertension. And so we have been working with community-based organizations to identify these patients and also provide medically tailored food boxes to them with fresh food options, recipes, and then also aligning these patients with education, lifestyle medicine education, how to make healthy foods, how to exercise, how to make these great choices. So we're trying to hit these patients upstream before they have these medical issues where you need a hospital system like a heart attack or this retroactive or downstream effect. So all these resources, we're trying to move that needle more upstream to improve the health of our community.
Yeah. Well, and I think that is just one of the coolest things to hear. The focus of a healthcare system is bettering the community, and that speaks volumes and why we need clinicians in leadership positions to recognize that, hey, we we can only do so much within the clinic setting that's going to directly impact a patient's outcome. We need to be doing more that extends beyond what some may even consider the regular reach of a healthcare system. And so I that's really cool and fascinating to hear about. So, something else I'm interested in, just hearing your perspective is you started your role as the chief population health officer in March of 2020. And I can't think of a harder time to step into a new role within a healthcare system. More specifically, I can't think of a harder time to step into a new role as a with that role being the chief population health officer in March of 2020. What was it like to serve in that role, and how did your clinical experience affect the decisions that you made in that time?
Yeah, that timing was I'm trying to think of a word, crazy, I'm not sure of a better word than that. It was a little overwhelming. Usually, as being a clinician, we're trained to on either evidence-based practice of we know how to take care of a patient with a certain diagnosis, or we've been trained because we've seen it done a certain way, see one, do one, teach one, this is how you do it. This was a brand new thing. What I didn't have like again a playbook to kind of go off of. What do we do? But we had great leaders in our organization. We had a great incident command team, and our organization really developed that telehealth platform very quickly. And because we had to shut down like a lot of other hospital organizations, so how do we still provide that care to the patients, but in a safe environment? So our teams did a great job of providing these virtual visits for both primary care physicians and specialists. So we leveraged that. We also leveraged our population health team to identify the social drivers of health on patients who are becoming even more vulnerable. So that was super impactful. How can we help these patients who are really suffering right now? And keep them from having worse health outcomes. And one of the interesting things, looking back, is one of the big social drivers of health was loneliness, especially in our elderly patients because of the isolation. And we know the studies that show loneliness and increases morbidity and mortality. So just having a nurse care manager reaching out to them periodically and having that human to human phone contact meant so much to these patients. I mean, I still hear stories from my patients about having that person reaching out to them. Another thing that we did is mass vaccinations. We set up drive-through vaccinations across our locations, and that was very effective. And the other thing we did is also mass testing. So we had drive-through testing for patients, which were all taken care of for them, and the operations team did a great job with that. I think the other thing that I was really proud of our organization is just the leadership for our community. We had infectious disease physicians, we had our CEO really trying to be transparent with our community and educate them on where we're at, what are we seeing across the nation, how can we protect ourselves, and trying to decrease like fear, but give them the education they need, the confidence they need that we are there for them. So I was very proud of how our organization handled that transition, and they helped me transition through my role just because of the work they did.
Well, and again, I think it speaks to the importance of why we need people, and specifically clinicians and physicians in those leadership roles. At specifically the population health times, is just to be able to provide care for their communities and direct, um, create strategic goals for organizations that are patient focused and patient centered, and using the data acquired to better align what the clinics and the health care systems are doing to better serve the needs of their community. And so it's encouraging to me to hear just what Cox Health is doing and has done through COVID, and has continued to do so today. The way that you guys balance um, the strategic goals of Cox Health with the needs of your community there. Um, as we are just about getting close to wrapping up, I'm curious to hear. You've mentioned a number of times just the importance of constantly developing and learning as a leader, really as a person, but specifically within. It's a unique thing that leaders have to be well versed in is just the constantly learning and developing more and more and getting better. So how do you maintain a mindset that encourages learning, developing, and improving?
I think, and that's a great question and very important for leaders, especially even early on in their career, to really focus on developing these skills. I think having a growth mindset is very helpful. As a physician, especially earlier in my career, I was probably more of a fixed mindset person because the way I was trained, we have to be perfect, no mistakes. If you make a mistake, that's a failure. And that's not really healthy for a lot of reasons, especially even the culture of quality and safety. You need to not have that mindset. You need to identify what went wrong. But when something doesn't go the way you anticipate, maybe instead of accepting that as a failure, how can I learn from this? So making it a lifelong learning model, and that's the mindset that I try to focus on, is shifting from that fixed to the growth mindset. I've been blessed in our organization. They've been through two physician leadership cohorts over the last 20 years. And they've been very helpful too, just introducing some business education, communication skills, team building skills, things you might not have learned in medical school. So I think pursuing those opportunities, if you have those within your health system, is great. Even if not necessarily physicians, just clinicians of any sort are beneficial for that. Also different organizations. Right now I'm with the American Academy of Family Physicians leading physician well-being program, and that's a cohort that runs over 10 months. And we learn about leadership skills, process improvement skills, and physician well-being. It's been just a great resource that I've been using in building our physician well-being program, and the networking is amazing. Like the Stanford Well MD medical director course is also, I've learned a lot about physician well-being. So there's a lot of outside opportunities for one to continue to learn. Another thing that's been helpful is I've done a couple of self-assessments. You might have heard of DISC assessments or 360. Those are super valuable because we only know what we know about ourselves, and sometimes pointing these things out we might not recognize, and kind of improving our emotional intelligence and working on some of these skills can really impact your ability to be a great leader.
Well, Dr. Flax, thank you so much for coming on today and just the wisdom and getting to hear about your experience and the way you and the rest of your team navigated some tough times, some unprecedented times with COVID, and then the ways that you continue to ensure that your organization uh, is doing its job as it should, serving the community. I know I greatly benefited from the conversation, and I know anyone that listens to this will as well. So thank you for your time today.
Well, that's very kind, and thank you for the opportunity, Zach.